When discussing sexually transmitted infections in maternity nursing, it is essential to recognize how significantly these infections can affect both maternal and fetal health. In reproductive healthcare, early identification and understanding of common STIs are among the most important responsibilities nurses carry. Conditions such as chlamydia, gonorrhea, syphilis, genital herpes, human papillomavirus, and HIV continue to impact millions of individuals worldwide, including pregnant women who may not even realize they are infected. Many of these infections are silent in the early stages, presenting with few or no symptoms, which is why vigilance in assessment and screening becomes critical in nursing practice. During pregnancy, physiological and hormonal changes can alter the body's immune response, making infections more difficult to detect and, in some cases, more dangerous. Chlamydia and gonorrhea, for example, are bacterial infections that may appear mild or asymptomatic in the mother but can lead to serious complications, such as preterm labor, premature rupture of membranes, postpartum infection, and neonatal eye infections or pneumonia in the newborn. Nurses must understand not only the disease process, but also the emotional impact these diagnoses may have on patients who are already experiencing the stress of pregnancy. Syphilis remains one of the most concerning infections in maternity care because of its ability to cross the placenta and directly affect the fetus. Untreated maternal syphilis can result in miscarriage, stillbirth, congenital deformities, or severe neonatal illness. This is why prenatal screening is not optional. It is life-saving. Nurses play a major role in ensuring patients receive timely testing, understand the importance of treatment, and remain compliant throughout pregnancy. Viral infections present additional challenges. Herpes simplex virus, particularly active genital herpes near the time of delivery, raises the risk of neonatal herpes infection, which can become life-threatening for the infant. In many cases, careful monitoring and possible cesarean delivery may be necessary to reduce transmission risks. Human papillomavirus, commonly known as HPV, may lead to genital warts and is also associated with cervical cancer. While HPV often receives less attention during pregnancy, patient education and follow-up remain essential parts of reproductive health care. HIV management has dramatically improved over the years, and this is one of the most powerful examples of how nursing care can change outcomes. With proper antiretroviral therapy, prenatal monitoring, and safe delivery planning, the risk of mother-to-child transmission can be significantly reduced. However, achieving these outcomes depends heavily on patient trust, education, and consistent nursing support. Nurses are often the professionals who spend the most time with patients, making communication and compassionate care essential components of treatment success. As future nurses preparing for NCLEX and real clinical practice, it is important to remember that sexually transmitted infections are not simply diseases to memorize for an exam. They represent real threats to maternal and newborn health, but they also present opportunities for prevention, education, advocacy, and life-changing intervention. Understanding these infections thoroughly is the first step toward protecting two patients at once, the mother and her child. As we continue discussing sexually transmitted infections in maternity nursing, we must understand that assessment, screening, and diagnosis are the foundation of safe maternal and newborn care. One of the greatest challenges with STIs is that many patients may appear completely healthy while carrying infections capable of causing severe complications during pregnancy. This is why nurses cannot rely only on visible symptoms. A thorough assessment and timely screening process are essential responsibilities that directly influence patient outcomes. In maternity care, every prenatal visit becomes an opportunity to identify risks early. Nurses must begin with effective communication and a non-judgmental approach that allows patients to feel comfortable sharing sensitive information. Many pregnant women may hesitate to discuss their sexual history, past infections, multiple partners, or concerns about exposure due to fear, embarrassment, or cultural stigma. The role of the nurse is not to criticize or make assumptions, but to create an environment of trust where accurate information can be obtained. Without honest communication, important warning signs may easily be missed. A complete assessment includes reviewing medical history, sexual history, current symptoms, and behavioral risk factors. Questions regarding previous sexually transmitted infections, inconsistent condom use, substance abuse, or a partner with known infections can provide valuable clinical clues. Nurses must also pay attention to physical symptoms, such as abnormal vaginal discharge, pelvic pain, genital lesions, itching, burning during urination, or unexplained fever. Even though these symptoms may suggest infection, we must remember that absence of symptoms does not rule out disease. Routine prenatal screening is one of the most effective tools in preventing complications from STIs. Standard testing for infections such as HIV, syphilis, hepatitis B, chlamydia, and gonorrhea is recommended during pregnancy because early detection allows treatment before harm occurs to the fetus. Some patients may require repeat testing later in pregnancy if they remain at high risk. Nurses play a critical role in ensuring these screenings are completed on time and that follow-up care is not delayed. Diagnostic testing may involve blood tests, urine samples, cervical cultures, or swab specimens depending on the suspected infection. Understanding these tests is extremely important for NCLEX preparation because nurses are often responsible for specimen collection, patient teaching, and interpretation of abnormal findings that require immediate reporting. For example, a positive syphilis screening requires prompt intervention because delayed treatment increases the risk of congenital infection. Similarly, identifying active herpes lesions near delivery may influence decisions regarding birth planning and neonatal safety. Beyond collecting data, nurses must recognize the emotional impact that STI testing can have on pregnant patients. Anxiety, fear of judgment, concerns about relationships, and worries about the baby's health are common reactions. Therapeutic communication becomes just as important as clinical skill. Patients need reassurance, privacy, education, and emotional support throughout the diagnostic process. Nurses must protect confidentiality while ensuring patients fully understand the purpose of screening and the importance of treatment compliance. In NCLEX practice and real clinical settings, remember that early assessment and accurate screening are not routine tasks performed out of habit. They are preventive measures that can save lives, reduce complications, and protect the future health of both mother and child. Early recognition always leads to stronger outcomes. Once sexually transmitted infections are identified during pregnancy, the focus immediately shifts toward effective nursing management and safe treatment. This stage of care is critical because proper intervention can significantly reduce complications for both the mother and the baby. In maternity nursing, treatment is never limited to administering medication alone. It involves continuous monitoring, patient education, emotional support, infection prevention, and coordinated care that protects two lives simultaneously. One of the first priorities in nursing management is ensuring that treatment provided during pregnancy is both effective and safe for the developing fetus. Certain medications commonly used outside pregnancy may not be appropriate for pregnant patients, which is why careful medication administration and patient monitoring are essential. Antibiotics are often prescribed for bacterial infections such as chlamydia, gonorrhea, and syphilis, and nurses must verify allergies, monitor for side effects, and ensure the patient completes the full course of treatment. Incomplete treatment not only increases the risk of complications, but also contributes to reinfection and continued transmission. For viral infections such as herpes simplex virus or HIV, long-term management becomes extremely important. Patients diagnosed with HIV may require antiretroviral therapy throughout pregnancy to reduce viral load and minimize the risk of transmission to the newborn. Nurses play a vital role in encouraging medication adherence, monitoring laboratory results, and educating patients about the importance of consistency in treatment. Even small interruptions in therapy can affect maternal health and neonatal outcomes. When managing genital herpes during pregnancy, nurses must carefully monitor for active lesions, especially near the expected delivery date. Active outbreaks may increase the risk of neonatal herpes infection during vaginal birth, and this can lead to severe complications for the infant. In some situations, cesarean delivery may be recommended to reduce exposure. Nurses must be prepared to educate patients about these decisions while providing reassurance and emotional support during what can be an overwhelming experience. Infection control is another major aspect of nursing management. Proper hand hygiene, use of personal protective equipment when necessary, and safe handling of specimens are all essential practices in reproductive healthcare settings. Nurses also educate patients on reducing transmission risks, including abstaining from sexual activity during active infection, encouraging partner testing and treatment, and reinforcing the importance of follow-up appointments. Equally important is the emotional and psychological care provided to patients. Many pregnant women diagnosed with STIs experience guilt, fear, shame, or anxiety about how the infection could affect their baby or relationships. A calm, respectful, and supportive nursing approach can greatly influence patient cooperation and treatment success. Nurses must provide factual information without judgment and ensure patients understand that many infections can be successfully managed with early intervention and proper care. Patient education remains one of the strongest nursing interventions in maternity care. Teaching should include medication instructions, symptom monitoring, signs of complications, prenatal follow-up requirements, and newborn protection strategies. Nurses must also educate patients about the importance of treating sexual partners to prevent reinfection. In NCLEX scenarios, questions often focus on prioritization, safety, and patient teaching, making these interventions especially important to remember. Ultimately, nursing management of sexually transmitted infections during pregnancy is about more than treating disease. It is about protecting maternal health, preventing neonatal complications, and ensuring every patient receives compassionate, evidence-based care that promotes the safest possible outcome for both mother and child. As we conclude this discussion on sexually transmitted infections in maternity nursing, it is important to understand that prevention and education remain the strongest tools we have in reproductive health care. While treatment and medical management are essential, many complications associated with STIs can be avoided entirely through early education, safe practices, and consistent prenatal care. Nurses are not only caregivers, but also educators, advocates, and protectors of maternal and newborn health. The knowledge we provide to patients often becomes the difference between preventable complications and healthy outcomes. One of the most important responsibilities in maternity nursing is teaching patients how sexually transmitted infections spread and how transmission can be reduced. Many individuals still lack accurate information regarding STI prevention, particularly during pregnancy. Nurses must provide clear, respectful, and culturally sensitive education about safe sexual practices, consistent condom use, limiting exposure risks, and the importance of mutual testing between partners. Education should never create fear or shame. Instead, it should empower patients to make informed decisions about their health and the health of their unborn child. Prenatal care compliance is another major focus in prevention. Regular prenatal visits allow healthcare providers to monitor maternal health, identify infections early, repeat testing when necessary, and intervene before complications occur. Unfortunately, some patients delay or avoid prenatal care because of financial difficulties, fear, social stigma, or lack of understanding about its importance. Nurses must encourage patients to attend appointments consistently and explain that prenatal screening protects both mother and baby. Even when patients feel healthy, silent infections may still be present and capable of causing serious harm if left untreated. Partner treatment is equally critical in preventing reinfection. A patient who receives treatment but returns to an untreated partner remains at risk for acquiring the infection again. Nurses must educate patients about the importance of partner notification, testing, and treatment while maintaining confidentiality and professional communication. This can be a difficult conversation for many patients, which is why therapeutic communication skills are essential in maternity nursing practice. From an NCLEX perspective, prevention and education questions often focus on patient teaching, prioritization, and safety. Future nurses must recognize which interventions take priority in protecting maternal and fetal well-being. For example, identifying signs of neonatal infection, educating patients about medication adherence, recognizing the need for repeat STI testing in high-risk pregnancies, and understanding isolation or delivery precautions are all common NCLEX concepts. The exam is designed not only to test knowledge, but also to evaluate clinical judgment and the ability to provide safe, patient-centered care. Another key nursing priority is newborn protection. Certain sexually transmitted infections can pass from mother to infant during pregnancy, labor, or delivery, leading to complications such as blindness, pneumonia, neurological damage, or systemic infection. Nurses must remain alert during labor and postpartum care, ensuring that newborn assessments, medications, and preventive interventions are completed accurately and without delay. Early recognition and intervention can dramatically improve neonatal outcomes. At the heart of all maternity nursing care is compassion, education, and prevention. Sexually transmitted infections may present medical challenges, but they also provide opportunities for nurses to educate, support, and advocate for healthier futures. Every assessment completed, every question asked, and every patient educated becomes part of a larger mission to protect both present and future generations through informed and compassionate care.